what you never thought you knew about Accutane. So Accutane was the first branded isotretinoin on the market. It popped up in the early 80s from Roche Pharmaceuticals, and it was a game changer. It turns down, this is how I explain it to my patients, it might be a little bit more scientific, but it turns down the production of the oil in the highly productive oil glands. In the oil glands of the body where it doesn't produce as much oil, it also turns that down, and then there's a dry sensation that is the #1 side effect that is experienced by patients taking isotretinoin. And when it binds to the epidermal cells, it turns over those cells very quickly. And so they are replaced and turned over and replaced and turned over. And so there can be initially a little bit of thinning because the skin cells, they sort of flake off very quickly. But then down below, they're regenerating to catch up. So there can be a little bit of flakiness, a sense of dryness, a sense of redness. And if the dosage of the Accutane is a little too much for the patient, then they tip towards that overdry scale really quickly. And then those sensations that come with the skin, irritation, as well as redness, dryness, flakiness, can be overwhelming. On the lips in particular, because there's no oil glands on the lips, you can get a full-on crack, and of course that is painful and not pleasant. So that's kind of what the image of the Accutane patient is, and it conjures up in a lot of people's mind. But it's so much more than that. So we use Accutane for oil control. And oil in abundance, the sebum in abundance, can be a nidus for microorganisms, and it can have breakdown products that are then targets for your immune system. And hence we get conditions like acne. The acne can be comedomal acne, which are plugs of oil in either the blackhead form or the whitehead form, where there's a little cover over the oil. They can also have redness around them. And even though that acne visually from 3 feet away, 5 feet away doesn't look bad, it can be very scarring and leave pits behind, which are not easy to correct. Then there's acne that is papular and pustular, a classic whitehead. It can also help for that type of acne. It can help for immune-based adult acne, in females especially, that is very, very difficult to treat. Rosacea, believe it or not, bad seborrheic dermatitis, and I use it in my practice even for just plain oily scalp. So a lot of people have an oily scalp where the oils build up over a day within that 24 hours, and they can smell the oil, they feel the presence of the oil, it wears their hair down. And then this is where Accutane is used a little bit more aesthetically and a little bit more for lifestyle, which, you know, this is a real deal if you have super curly hair, really thick hair, and you have a little bit of dandruff, you have a little bit too much oil, and you cannot possibly wash your hair twice a day or every day. A little bit of Accutane over the course of a week can save the blowout at $100, and the cost saving over the course of a year is unbelievable. The oil production, say, on the chest or back to save white shirts. So Accutane can be dosed very low and very appropriately for each person's individual circumstance. And the course ranges can range from a few months to many, many months. I've had a few patients where they have used a few months over a few years during their challenging years of acne. In the T-zone areas, I've had grade 9s and grade 10s for, you know, confidence in high school. Then in university with the stress, there was more breakouts. And then age 25, 26 in their first job. They don't want to be the new person in that first job still having the facial acne when they're shaving every day and putting on a tie or a sports suit, and they want to be confident and represent their best face forward. When I'm consulting with a patient and I do note that there is some overabundance of sebum production in particular areas. So it could be the T-zone, it could be the face globally, it could be the back or chest or the scalp. I always offer it up on the table as an option. In some circumstance, I will suggest it strongly as first line. There should not be as much anxiety around this word as there is. It stems from a long mythological as well as repeating the same old story, repeating misinformation and disinformation through family to family, school to school, and then of course more recently on the internet. There are a few important differences between the use of Accutane in the US compared to Canada. One is the price. If you are 25 or younger in Canada, it's for free. So it doesn't cost you anything. It's going to be way more affordable to treat the acne up front and to calm the inflammation in the skin than it is to pursue scarring treatments down the road. If you are female and you want to, or it is encouraged to have a birth control pill as well as your Accutane, they're completely compatible with each other. And the birth control pill is covered 25 and younger, certainly in Ontario. So there are a lot of options for a lot of individuals out there. The anxiety around Accutane stems from two main issues, which is, as a female, there must be a plan in place to not get pregnant while taking the medication. Accutane in no shape or form has anything to do with fertility issues at the time or down the road. So this is a phrase where don't get pregnant while taking the medication has been a little twisted and turned around to imply that it can allow someone to not get pregnant, which is wrong and incorrect. Another myth is that it might cause fertility issues in men, which it does not. The issue in men is that there is a theoretical, although it's so infinitesimally small, risk of the medication creeping into semen and then the semen transferring over to a pregnant female at the time, which when you think about it is an infinitesimally small theoretical risk. But it was brought up over and over and over in the US climate where there's a little bit more litigious type of climate overhanging the patient-doctor interactions. The next issue is on mood. My own personal belief is that Accutane, being a very metabolically active vitamin A derivative, is telling your skin to grow faster. And our skin is the largest organ in the body. So if all of our skin is getting really revved up and energetic and growing faster, sometimes I believe that those protein reserves and that growth momentum takes away maybe from other areas. We've all seen the 10-year-old boy or the teenager going through the growth spurt where they were in bed for 14 and 16 hours a day with achy muscles because they were growing. Accutane can make the skin go into action and grow, and it can leave people feeling a little sluggish, a little tired. We don't get the response back from patients where there was a definitive, true mood change. That is very, very rare. It does happen. Everyone is counseled on this condition. I have had very stable patients on SSRIs for, say, a clinical depression or general anxiety disorder, take their Accutane, and they did perfectly well. And they were thrilled with the outcome of their skin condition. So when monitored correctly and used in low doses appropriately, maybe the course of action is a little bit longer overall. It can be used quite safely for a lot of people. So the anxiety around Accutane should not be perpetuated just on a few pieces of misinformation and disinformation in and itself. And that's why I'm here talking to you about Accutane today. Hopefully it gives you a frame of reference and takes away some of the myths or the rumors that you've heard online that are repeated. And I do believe that every patient has their own perspective, which is very legitimate, but it has to be seen in the global context of everyone else's personal context and experience as well. I know a lot of my patients by name who have been on the Accutane and are thrilled, and they could not speak highly enough about it and its usefulness. Thanks for watching. We're here to educate and inspire and help each and every one of you. Our information is below, so if you want to get in touch with us, there it is. And we're here to help. I'm Dr. Marnie Fisher. Thanks for watching.